Welcome, everyone, to a great new webinar with cosmetic laser dermatology with Dr. Boen. You are tuning in to our Take 10 and Take 5 uncovered and introducing our brand new device, UltraClear. Dr. Boen is going to walk you through UltraClear, our newest laser, and also kind of break down more details about Take 5 versus Take 10. How are they different? How do they include UltraClear? So that you can really understand what your options are and what might be best for you. So, Dr. Boen, if you haven't met her yet, she's one of our esteemed board certified dermatologists. We love Dr. Boen. She's been with us for, I don't know, almost like a decade now, I think, almost. And Dr. Boen is known for very natural results. She has beautiful rapport with her patients. She has two young kids, so a lot of you are probably in similar age as me and her, and also in this postpartum, having babies, what does it do to our skin, being a young mom and not having enough time to take care of our skin. So I'm really glad that all of you took some time out today to focus on yourselves to learn about this. And Dr. Boen, while she's talking about the Take 5 and Take 10 and UltraClear today, I want to make sure that everyone knows that all of our providers at Cosmetic Laser Dermatology, all of our board certified dermatologists do offer these treatments. And on the flip side, even though Dr. Bowen's only talking about lasers today, she's also phenomenal with injectables and body sculpting and a lot of other types of aesthetic treatments as well. So, Dr. Bowen, the floor is yours.
Thank you so much for coming to our webinar. I'm very excited to talk to you about some of our signature procedures, our Take 10, our Take 5, and introducing one of our newest lasers, the UltraClear. Lasers can help preserve and enhance your skin quality and health without making you look unnatural. Now, in the aesthetic world, there has been a focus on natural looking results and preserving your skin. And this is where lasers can benefit you. Recently, I published this hot off the press about a month ago with my colleagues, Dr. Sabrina Fabi and our newest fellow, Dr. Elizabeth Cream, where we discussed strategies to extend skin longevity. There's been a lot of talk on wellness and improving health span, and we introduced the concept of skin span. While looking great while you feel great by exercise and diet and improving longevity, you also want to make sure that your skin matches. And there's things you can do to preserve your skin. We discussed emerging therapies, but also we discussed that many of the treatments are available now, and we've done them for years. We just only realize now the benefits that they have. So the treatments that we offer stimulate fibroblasts. These are the powerhouse cells in the skin that stimulate collagen and elastin synthesis, which, as you know, only decreases with time. And so these treatments can help you maintain a good collagen and elastin production. You can have matrix remodeling. So over time, you want to make sure too that there's a healthy extracellular matrix. There's an increase in growth factors after certain laser procedures, and that help you repair and regenerate skin. If you notice on kids, they have flawless skin, no texture issues. It's because they have very good DNA repair enzymes. And so with lasers, we're trying to stimulate this for the aging population. Another big thing in longevity is something called cellular senescence. So we want to make sure that we get rid of the cells that are not working properly. And then you do get long-term remodeling. And the newest thing is epigenetic changes. We think now that perhaps lasers can reset gene expression. There's a little kind of science behind some of the things we do. In our clinic, we do emphasize treatments backed by science and evidence medicine. And we have a huge research center as well, where we are developing new lasers, injectables, and other techniques for aesthetic procedures. And a lot of the lasers we have, I will talk about today, we have extensively researched already in our research center. The goal of aesthetic procedures is to fit your goals, whether it is to improve skin texture, have radiant, glowy skin, get rid of redness, but also match your lifestyle. And that's why today I will talk about 3 signature laser procedures That addresses certain goals, but also keeps in mind your lifestyle and downtime. First, we'll start with the Take 10. The Take 10 is one of my favorite procedures to perform. The core laser of Take 10 are the ablative CO2 and erbium lasers. We have the luminous ultrapulse, the Cyton erbium YAG, and the Fraxel repair. These are some of the top of the line lasers for helping reduce deep lines and wrinkles. And we also combine this with other non-ablative lasers to target redness, brown spots, as one laser does not treat everything, unfortunately. And I also combine this with Botox and injectables for an overall aesthetic optimization. And this procedure really does take up to 10 years off your appearance without any surgery. And this was pioneered at cosmetic laser dermatology over decades of research and expertise. And at our center, all of our doctors who perform these procedures are board certified dermatologists. We have extra training in these laser procedures and true expertise in this area to deliver these results safely and effectively for you. So what can you expect in terms of results for Take 10? This is truly a laser that can improve fine lines and wrinkles like no other procedure with no surgery. It evens skin tone and complexion. We're getting rid of a lot of that photo damaged skin and triggering DNA repair enzymes and overall collagen production. And this is why you have improved skin radiance and glow. In addition, as I talked about previously in keeping skin span in mind, is that we are also improving skin health and quality. A lot of studies show now that with certain lasers, especially CO2 or the Fraxel Dual we'll mention later, there is a skin cancer preventive aspect of this. Something is going on at the molecular level to improve skin health with these lasers. Who is a good candidate? Patients who have deep lines and wrinkles, who have brown and red discoloration or a lot of photo damage, has some mild skin laxity, and has acne scarring. So some of our younger patients who do the Take 10 are patients with extensive acne scarring and want more of a one or two procedure than doing multiple procedures for their acne scars. And patients with early signs of aging and who do not want surgery, and you can tolerate some social downtime. These are just some examples of patients I think would do well with this procedure, and congrats on the Emmy win. So the core lasers are our CO2 and erbium YAG laser, and I will show you an example of how these lasers are used. And there's truly nothing like it for skin tightening, especially around the eyes and around the mouth. And this is an example of a patient who had this is our UltraClear CO2 laser. As you can see, there's amazing skin tightening and skin contraction. And this area is completely numb, so the patient is comfortable, and there are metal eye shields in the eye to protect the eye. We make sure to have safety be a top priority. In addition, you'll notice that there are some wet towelettes throughout to make sure the procedure is safe. This is some of the laser technology behind the ablative and fractional ablative resurfacing. In certain modes, we do ablate a portion of the skin to regenerate that collagen and get rid of some of the photo damaged cells. And in others, we do a fractional ablative resurfacing where only the fraction of the skin is treated so that you have a faster healing, and this is tailored to the patient. The other lasers used in conjunction with our Take 10 procedure are the V-beam laser for redness and telangiectasias. And I also use these lasers separately for rosacea and other conditions, or our intense pulse light laser, which targets redness and hyperpigmentation and is also a good maintenance laser after this procedure. And then our PicoWave, PicoSure, or Q-switch Alex lasers that target pigment. And we are unique in that we have 3 pigment lasers. These are top of the line lasers, and not all clinics have all of these lasers available to them. This is an example of using the V-beam and intense pulse light M22 laser which is also one of the top of the line intense pulse light lasers. This is an example treatment. So first, and this patient I treated more for acne and redness and rosacea. So first, this is the V-beam laser. Next, you can combine these safely in the same day, is the intense pulse light laser to target reds and browns. And this is something we may combine in our Take 10 laser, depending on your goals and your skin needs. How do you prepare for a Take 10 procedure? First, I want to optimize skincare. We do the Take 10 procedure once, but your skincare you do every day. And so I want to make sure that we are starting well and then optimizing your skincare post procedure along with maintenance procedures to optimize and maintain your results. So these are some of my favorites: the Elastin C Radicals, SkinCeuticals PTOX, SkinMedica TNS Essential Serum. I have several others. I am big into skincare, and then the Elton, the UV Clear, or the Isden is one of my favorite sunscreens. Sun protection before is very crucial for this procedure in particular. Also, prior to the procedure, I do recommend Botox, Dysport, or other neuromodulator treatments that will help relax the upper and lower facial wrinkles. If we treat them with a laser, they will be the lines will be gone for a while, but then the repetitive muscle movements will bring back the lines. And so by doing regular Botox treatments, you will maintain wrinkle reduction in those areas. And then there's other biostimulatory fillers such as Sculptra, Juvederm, RHA. I use this for facial scaffolding and volumization. The lasers will help tighten the skin, but sometimes we need some light volumization. And with the fillers, I use a very natural approach and make sure that you have a natural result with your fillers. And so let me go a little bit about what entails in our Take 10 procedure and the downtime. Our Take 10 procedure is performed in an on-site OR, which is as part of our clinic. And we're unique in that we do have a dedicated OR team who is very well versed in this Take 10 procedure. They know how to counsel on wound care. So right from the start of your procedure, a nurse will call you for a pre-op visit and prepare you for the procedure. They will make sure that you have a driver because mild sedation is used, and then they will walk you through the procedure. And this procedure takes about 2 to 3 hours in the OR. For this, mild sedation is used, and the entire face is injected with lidocaine to make sure it's comfortable, as this is a more aggressive laser, and more enhanced results, as we say. The day of the procedure, expect to have swelling, redness, and this heat sensation. So right afterwards, we do a nice vinegar soak, and our nurses will explain the whole wound care process. On day 1 through 3, you do have a lot of swelling and redness. You may not like me because of the swelling. And then day 4 through 7, it's a little easier. There's crusting, redness, and mild swelling. And there's some expected redness for a few weeks after the procedure. However, after all this procedure, the most important for me are for patients to have their results. So as you can see, after this laser, we have a very nice reduction in fine lines. You can notice along the jawline, there is a nice skin tightening effect. And this is just from laser. And here we did face and neck. A lot of the photo damage is erased, the redness and brown. And you notice an overall glow to the skin. And this is 6 months after the Take 10 procedure. And the glow of the skin is from your own body generating this collagen and elastin and restoring some of the youthful appearance of the skin. That's the whole goal of these lasers, is to restore the skin quality and then preserve and maintain. As you can see, patient still looks like herself, but there's nothing like this procedure on the skin, and especially under the eyes, the wrinkling around the mouth, and you still look like yourself. So the goal is just more luminosity, less wrinkling, but still looking like yourself, and overall improvement in skin health. This is one of my favorite procedures if patients have the downtime and they have these stubborn under eye or peri orbital wrinkles. And we can do smaller procedures if patients don't have the downtime, but if they truly want a skin tightening and a wrinkle eraser, the CO2 is a good option for patients who show the early signs of aging, which is under eye wrinkles. Well, usually I reserve this procedure for a slightly older demographic and patients who have extensive photo damage because they were lifeguards or surfers or worked outside a lot. This can be a great procedure for them because not only will they have decrease in their photo damage, but they may have benefits down the line of decreased risk of precancer, actinic keratosis, because you're getting rid of that top layer of photo damaged skin, and perhaps decrease in overall basal cell and squamous cell skin cancers, as we are are we removing a lot of those photo damaged cells in this procedure. And so and living in San Diego, we do see a lot of sun damage. And so for those patients, the Take 10 can be a good procedure. Next, we're going to talk about our Take 5. So our Take 5 procedure is something we've been performing for years and years, have been developing for years and years. But now we've kind of all put it together. So our Take 5 is a core laser of our Fraxel dual laser, which is a 1927 nanometer non-ablative fractional laser. And then we combine this with our other non-ablative lasers, Botox and injectables, for an overall enhanced aesthetic appearance. And this procedure was developed because patients they want the results of improved skin quality and fine lines, but they may not have the downtime for a Take 10 procedure. And this is where the Take 5 procedure comes into play. I position this procedure in between a Take 5 and then our lighter procedures, such as our Clear and Brilliant and Intense Pulse Light lasers. It's for patients who perhaps want to come in once or twice a year and want a bigger procedure to get rid of their brown spots, improvement in skin quality, and redness. And we have a nice infographic to compare the Take 5 versus Take 10. So we have different base lasers. The ablative lasers are the base for the Take 10, while for our Take 5, we have a non-ablative laser, the Fraxel Dual, as our base. And this non-ablative fractional laser is you less downtime. We still can do a same combination of these uh, picosecond V-beam and other lasers to add on for both. They both treat red and brown discoloration and improve skin qualities and fine lines. The Take 10 just improves more the deep lines and deep wrinkles. The Take 5, you only need topical numbing, and you can also use a laughing gas. And for our Take 10, this is light to moderate sedation in our OR. There is much less downtime with our Take 5, and the aftercare is relatively simple, as I'll go over, with a bland emollient gentle cleanser and sunscreen, while with our Take 10, we do have a strict wound care protocol to make sure that you are healing well. And so patients who are good candidates for a Take 5, they range from patients who have acne scars and sun damage, so they're a younger patient demographic, to older patients who maybe do have more deep set lines and wrinkles, but do not have the downtime or cannot tolerate a bigger procedure like our Take 10. And this is where our Take 5 can really help these patients. These are some of the results after one treatment of a Take 5 for the face and neck. So this is even skin tone and complexion. So the hallmark of this procedure is improvement in skin tone and complexion and glowy skin. It improves skin radiance and glow, decreases fine lines, and this also improves overall skin health and quality. I'll go a little bit more into our Fraxel or dual laser. So how it works, it creates these thousands of tiny columns of, we call these microscopic treatment zones, and they have controlled thermal injury. And after the treatment, you'll notice a little brown dots. You can see them a little in this photo and video here. And these are the microscopic thermal zones. So you can feel the sandpaper like quality the day of and throughout your healing process. And this is this is how some of the pigment is shelled out, and also gives you less downtime as there is some non-treated skin that allows faster healing. And this is how, and this patient also had her chest done too. So the Take 5 can be performed on the face, neck, chest, and hands and forearms are another popular area to perform this procedure. And this is a rolling device that delivers the energy in a fractional pattern. We have a cooling fan to help. And this is what to expect the day of. A little redness and swelling. And then usually day 3 through 4, you get a little bit more crusting after this procedure. With the Take 5, we essentially only need topical numbing. You can drive yourself to this procedure. You can take Tylenol, ibuprofen for further pain relief. And aftercare is also relatively simple with a gentle cleanser, ointment or moisturizer, and sunscreen. The day of the procedure, as you saw in the video, there's some swelling and redness that continues over day 1 through 3. And then around day 3, 4, you have this minor crusting in this sandpaper like manner, which exfoliates on its own. So much less downtime than a Take 10 procedure. A lot of us in clinic have performed a Take 5, then we go back to work the next day. We are a little red and crusty, but it's not something that you have to hide out from the world like one of our more aggressive procedures. And these are some of the results. So for this patient, I used a Q-switch Alex laser for the sunspots, and then a Fraxel Dual for the background pigmentation photo damage. And this truly I think sometimes you don't realize that improving some of the pigmentation and sunspots can really improve your overall appearance. And so a lot of times patients will sometimes they'll just ask for one brown spot to be removed. And then like, wait, if we globally treat the skin with this procedure, you will look more youthful and the skin will look more glowy versus treating just one spot. Younger patients who have acne scarring or photo damage can also benefit from this procedure, and it is also a faster recovery for them. And then overall, the even tone luminescence is something that is a really signature of the Take 5. You know, patients who have redness, stubborn sunspots, and skin texture issues. The Take 5 will address all of these in a single treatment. And a lot of patients, they do like this treatment so much, they do come in yearly for this laser. And then perhaps at 6 months, they do a lighter laser to maintain these results. And also, this can be performed on other parts of the body. The hands are very popular. A lot of times we can get this result in one treatment, and the hands have suffered a lot of photo damage. So it is a good idea to, usually when we do the face, we'll then start with the hand and the chest next. So now let's talk about our newest laser, the UltraClear. So we were actually the first in San Diego to have the UltraClear laser. And I also forgot to mention, we do have the newest Fraxel Dual laser, and we were the first in the country to receive the newest Fraxel Dual laser. So what is the UltraClear laser? This is a new technology. It's a fractional ablative erbium laser. And why is it called a cool laser? So it's called a cool laser because it can precisely target skin layers in an ablative manner without excessive heat delivery. So when you have this laser in some of the modes, it is not painful because there's not a lot of excess heat. And that also leads to a little faster healing times. And so this is the concept between this cool laser technology of the UltraClear. There's 3 levels of treatment, so we can focus on the top texture of the epidermal layer, which is a 3D miracle, which I will focus on today just for the sake of time. And then there is a deeper mode called the UltraClear, which I do for more extensive, deeper lines and wrinkles. And also, I combine this in my scar treatments to individually treat very stubborn scars with the ultra clear setting. And there's also laser coring, which we'll address in a separate webinar. So the 3D miracle can be used on the face, neck, chest, arms. It is a minimal social downtime procedure. It can be used on all skin types, which is nice. The ultra clear laser is truly versatile in that now we can offer this treatment to a variety of patients. It helps with texture and tone and sun damage, but overall, it is a nice rejuvenation laser with minimal downtime, and you get a nice glow as seen here. Then we have our moderate settings for the Ultra Clear, and this is very nice that this device is very tunable and versatile. And this is a moderate downtime, 3 to 5 days, and this is something I will do if patients want a little bit more improvement of lines and wrinkles. And then we have the advanced treatments too, which take a little bit more downtime. So the 3D Miracle is good for patients who have fine lines, deep wrinkles. I've been using this a lot for some stubborn lines around the mouth and under the eyes, as well as the overall face. It does take a series of treatments, so it is not like a one-time treatment like our Take 10. And it's good for skin texture irregularities, photo damage, and scars. And I do like that it's safe for a variety of skin types and it is customizable. This is an example of doing the 3D Miracle and a patient. Very comfortable. We don't even need any cool air for this. And it is performed relatively quickly. And then afterwards, you get these little dots, and this is the fractional pattern after this fractional ablative erbium laser. And it looks like this right after, and then you do have some redness for uh, a few days, very minor crusting. And I want to give you an example of the downtime after a 3D Miracle treatment. So it is a very low downtime. There's just some minor crusting for 2 to 3 days. This is an example of some treatments before and after the UltraClear. And this does give a nice glow as it targets the top epidermal layer of the skin with the 3D Miracle. And it's very customizable. I've been using it a lot too for surgical scars and acne scars as an addition to our other laser combo treatments for these stubborn aesthetic concerns. And that we do have stronger settings for scars. This example after a series of treatments for acne scars. And you can see it also improves texture and pigmentation. And as you can see, can be used on a variety of skin types. So we're very excited to offer the Ultra Clear laser as a standalone and as a combination treatment for your aesthetic goals. So I will end now with just some takeaways of the Take 5, Take 10. We offer these procedures to based on downtime and goals. But of course, when you see me in person, I will guide you and happy to answer all your questions to see which procedure works for you. We also have many other lasers that can fit your goals and injectables and Botox. And my goal is to help you and to help you achieve your aesthetic goals with your lifestyle. And thank you. Thank you for listening.
Beautiful. That was amazing. Thank you so much, Dr. Bowen.
Thank you for your time and spending the evening with us. And this will also, I think, be on YouTube later as well.
Yeah,
So if you need to go back for more info, you can always find this video later posted.
absolutely. Thank you so much, Dr. Bowen, for taking this time with us also after your long day of patients. And thank you all so much for joining us. We can't wait to see you at Cosmetic Laser Dermatology for your Ultra Clear or your
Mhm.
Take 5 or your Take 10 or any of your cosmetic needs. All right. Hope
Great.
to see you all
All
soon. Thank you.
right. Take care. Bye.